Welcome everyone to today's Pro Bono Financial Coaching Program Case Studies webinar led by Rick Fingerman. This program is hosted by the Blum Resource Center. Over at the Blum, we are grateful to Rick for this continued partnership. The recording of this session will be posted on our Blum YouTube playlist in our Blum Digital Resource Center. For those of you watching live, if you have any questions related to today's program, please feel free to utilize the chat feature throughout the session. At the end of the session, your questions in the chat will be used to moderate a Q&A. If you have any other questions or would like more information about resources and programs offered through the Blum, please visit our website at www.dana-farber.org/resource center or email us at blum_center@dfci.harvard.edu. Thank you all for joining us. I will now pass the workshop over to you, Rick.
Thank you very much. Okay, here we go. So this is just another series of how to manage finances during cancer treatment. It actually isn't specific to cancer treatment, but these are things that I come up with from based on the patients that we talk to, and we put these things together to see if we can help make people's lives a little bit easier. This is actually a case study of a married couple that we worked with. Names have been changed, of course, to protect the innocent. But this is a married couple, and it was back in the early part of this year. So a little bit who I am. I'm that guy in the middle holding that little trophy. We've run this program since 2008. It's a pro bono financial coaching program. It's a mouthful, but it's available to all patients of Dana-Farber and their families that are struggling in one way or another financially. It could be that maybe a spouse is out of work. It could be that a caregiver is out of work. It could just be that bills have accumulated, that you're just not able to kind of make ends meet. There's all kinds of ways that we can help people with debt, restructuring, estate planning. If somebody needs an estate plan, we have estate planning attorneys that at no cost to you, generally speaking, can provide an estate plan. So it's definitely something to look into. The last slide has my contact info, but if you feel like you need any help financially at all, we're here to help you. Again, no cost to you. This check for $5,000, any money that we won through different means, we donate to the Patient Assistant Fund. And if that's something you don't know about, I would talk to your social worker or your resource specialist. It's a little stipend that you could get if you qualify that helps with things like paying for parking or just buying food while you're at Dana-Farber, or you can even use it to pay your gas bill, whatever it might be. So something to look into if you haven't heard of that already. Just a quick disclaimer, this presentation is strictly educational at all. It's not meant to be legal or tax or investment or medical advice or anything like that at all. But again, if you have any specific questions, I'm happy to talk to anybody that's affiliated with Dana-Farber. Again, my contact info will be on that last slide. So this was the story. Carl was diagnosed with stage 4 pancreatic cancer in December of 24. Not a good diagnosis. So here's just kind of the first steps. We want to acknowledge this journey, that we want to make sure that we kind of get our financial and estate life together. So the stage 4 diagnosis, again, it was a life-altering event to say the least. Now, emotionally difficult. We want to see if we can take some action to just ease these future burdens on ourselves and our families if this happens. And this presentation kind of offers some steps just to give you a little bit more control, because I have found I've been doing financial planning for 35 years. And if we can do this while we're feeling pretty good or before something bad really happens, it's definitely the way to go. We don't want to wait last minute on any of this stuff. And it's really easy to procrastinate when it comes to this stuff because it's not pleasant to deal with. It's just not fun. I'd rather watch Netflix than work on my estate plan. It's just that's just how we are, right? So number 2 is just, making these key financial priorities. We have to address these sooner than later. We want to first look at cash flow needs. A lot of our patients that are kind of struggling because one or both might be out of work, money coming in versus money going out might not look like it did when somebody was working. So we want to look at that and see maybe there's other ways or other areas we can get cash to come in. And there are better ways than others to take cash. Some people have said, well, should I close out my 401k or my IRA? And that might be the right answer. But again, we have to look at the big picture because it might not be the right answer. And there could be definitely better ways to access cash. We also want to look at different insurance coverage. We want to look at your health insurance, life insurance, disability insurance if you have it. If you don't have disability insurance through an employer and you're no longer working, there's Social Security disability that you might be eligible for, so we can help look at that. And that's what we did actually with Carl. But we want to also look at maybe auto and homeowners insurance too, because there might be ways to save money there. And when our income has dropped for whatever reason, it's a good time to look at expenses. And whether it's, insurance, things that you can control, or just dining out even, there's certain things you can do to keep a little bit more money in the household. So we want to look at that. And then we want to look at any debts or liabilities because some of these debts do not have to be paid off, for an example, at death. And like a federal student loan is a good example of that. If somebody dies owning a federal student loan, not one through a bank or a private loan, you're not obligated to pay that debt off upon death. So there's things we want to look at again to make sure that you're in a good place. Number three is to simplify things. I'm big on simplifying and consolidating things. We have clients that come to us to do financial planning, and they might have 30 accounts all over the place. And it just gets really cumbersome to manage all that. So if you can consolidate things where possible, it's a really good idea. Here's an example. Somebody might have 5 different IRAs from previous jobs lying around. Well, it might make sense to put those in one IRA. Again, we have to look at it, make sure that it makes sense. You also want to organize any kind of statements, logins, contacts. For our clients, and we can share this with patients as well, put together kind of just a little cheat sheet list of who to contact if something happened, whether someone's disabled or passes away. It's a list of people's account numbers, the telephone number, so the family knows exactly where everything is, how to like not miss anything, have things slip through the cracks. Automating, any kind of bill pay definitely makes sense because it's just one less thing for people to have to deal with when they're not feeling well. So if you can set up that your gas and electric bill is just paid automatically, your cell phone bill, things like that. You want to be careful though, because if you have that tight cash flow issue, you don't want to bounce checks or have a negative balance. So you have to be careful with that as well. And then, having a list of just sources of income, whether it might be Social Security disability, it might be part-time work. Maybe you had to drop to part-time. Maybe your spouse is still working. Have a list of all those income sources and a list of your expenses. Again, we can provide you with some forms to use as a kind of a guide to see what that looks like so you can keep track of things better. And legal documents. So I mentioned before that if you are a patient of Dana-Farber, we generally can provide through one of our estate planning attorneys a totally free estate plan. If somebody has a large estate and has a ton of money, that might be a different story. But if for the average patient of Dana-Farber, we can usually provide this. And this consists of a few things: a will or a trust. A will basically just names, what they call a personal representative. That phrase used to be an executor or an executrix, but now they use personal representative in Massachusetts anyway. But it'll tell you like who kind of inherits what, who's in charge. That being said, if somebody has accounts like IRAs, retirement accounts, those generally have a beneficiary named. And if those beneficiaries don't align with your will or your trust, the beneficiary listed on that account will take precedent. So you want to be sure that everything's aligned. And working with the estate planning attorney and one of our coaches through this program, we can make sure that all that stuff's in the right buckets. Healthcare proxies or medical power of attorney, that's somebody that just makes decisions for you if you're unable to based on your health. So if you can't answer for you, there'll be somebody named that can provide that. I want this treatment, I don't want that treatment for this person. So that's a good document to have. And a durable power of attorney is the same thing, but it's for anything financial. So if you can't handle your finances, a power of attorney can do that for you. They can do anything from file a tax return to refinance your house, to apply for a home equity line of credit, to pay bills, all kinds of things that a durable power of attorney can do. And then there's HIPAA authorization. HIPAA is a big thing in hospitals. They make sure that all of your information is private. So without this authorization, your spouse or a child, might not have access to your medical records. So that's a good thing to have. And lastly is this living will. It's just an end of life document that kind of lets people know if you want to be on certain life support or not on life support. So these are all documents that are part of a good estate plan. Not everybody needs a trust. If you have kind of a simple estate, you probably don't really need that. But for something that's more complex, like if you're on your, third marriage and you've got 6 kids from previous, you know, previous marriages and things like that, and you want to leave certain kids certain things, a trust can be really handy when it comes to really complex stuff. So here's my list of estate planning musts. We want to make sure again that these beneficiaries on IRAs, life insurance, 401ks, 403bs, all of those types of accounts, that they're correct. Because again, those are going to, you know, kind of supersede whatever your wishes are in a will. If you say in your will you leave everything to your brother Billy, but your beneficiary on your IRA lists your sister Susan, well, Susan is going to get those IRA assets. They're not going to go to Billy. So you want to make sure that you look at all this stuff. And you want to retitle assets because if they're wrong, if you have something in your name alone, for example, and you're married, you might want to retitle that as a joint ownership or title it into the name of your trust, because if something happens to you, which was Carl's concern, he had a lot of these accounts that were in his name alone. We want to make sure that his spouse is on there either as a joint owner, or you can also add something called a TOD, which stands for transfer on death. That's similar to a beneficiary. Basically, if you have just a bank account in your name and you have this TOD provision that leaves it to your spouse or your sister, and you pass away, it just transfers to that other person. Without that, it could get stuck in the whole probate process, which is just designed to make sure that your estate is done properly, and that can take time and can be expensive. Review estate tax exposure. So again, for people that live in Massachusetts, we have a $2 million estate tax exclusion. If you have property, investments, a house, and it's all in your name and it's over that $2 million, you're going to pay an estate tax to Massachusetts. The federal level estate tax is much higher. You have to be pretty wealthy to worry about that one. But that's something to review, because before you pass away, there could be things you can do to eliminate or at least reduce that Massachusetts estate tax. And then gifting. Carl was wondering, like, hey, should I start giving money to my kids now while I'm still alive? Is that better than waiting till after I pass away? And you could do that. Doing gifting is a way to get that estate tax down as well. So you can give up to $18,000 in 2025 to anyone that you know or want to gift to without filling out any forms. There's no tax to pay for you or the recipient of that gift. So that could be a strategy that makes sense too. So again, we want to look at that, look at all this stuff. What do we hear? Number 6, plan for the surviving spouse. So this is something else. Carl was really worried about, like, when I'm gone, what's going to happen? Is my wife going to be able to handle all this stuff? So again, we want to evaluate all kinds of sources of income. In Carl's case, he was older. He was taking Social Security, which was much more than what his wife is getting. So when he passes away, her Social Security benefit will bump up to whatever he was getting on the day he died. So there'll be that income source. That's that Social Security survivor benefit. There's pensions and annuities. He had both, actually. He had a couple of annuities from old jobs. And we just want to make sure that those beneficiaries are named correctly. So his wife is on there as beneficiary of those annuities. And his pensions generally, if you're not taking them yet, you might have a couple of options. You can take a larger amount over your life, but when you pass away, it just goes away. Or you can take a lesser amount, and that can continue on to a spouse or another beneficiary. So in Carl's case, he did pick the option where money went to his spouse. So when he does pass away at some point, not only will she get his Social Security benefit, she will also get a pension from him and the annuities and other accounts, because we made sure the beneficiaries on all of his accounts aligned with basically going to his wife. He had a small life insurance policy, made sure the beneficiary on that was his wife as well, to make sure that that money went directly to her. And usually when somebody passes away, life insurance is pretty quick. As long as you let the insurance company know that the person passed away, they issue a check, relatively quickly. Things like pensions and Social Security could take a little bit longer. Investment income, we looked at their investments, didn't have a huge amount in investments, but whatever they had We put together a little plan so we knew exactly how much would be coming in each month for his wife. Ensure the survivor is a trusted advisor. Yeah, this is important too because if the surviving spouse or beneficiary doesn't really know who's, handled all this stuff, they're going to be like scrambling. So between having an advisor and having that little cheat sheet I mentioned that has the contact info, the phone numbers, the account numbers, between those two things, it's really great because then nothing slips through the crack and you can get these things get these things done. Creating a what to do if something happens guide, that's something that, this was just a kind of like a little piece of paper that Carl drafted up that just told, the family what he wanted. There was a few things he wanted to give to the kids, watch that he wanted to go to one son, and he had some fishing equipment for the other son. So that's just a good thing. So there's no questions to worry about. And that's something that can be brought up with the estate planning attorney when you're drafting your estate. So they can include that. It's not really a legal document. It's just kind of just like, here's what I would like. He was also pretty, you know, he was pretty vocal on how he wanted his burial to be. And we did a prepaid funeral for him. And that way his spouse didn't have to worry about that. He designed it exactly how he wanted it, put that in writing, was prepaid. So the funeral home had everything they needed. Those are things that, makes it easier on the family. My dad died very young. I was 19, did not have a prepaid plan, did not do any planning because he was 53 and didn't think he was, never thought he would die that young. And I remember my mother and I, kind of had to scramble and do a lot of work, which was a little extra stress on top of, losing a loved one. Number 7, I think we're in the home stretch here. Organizing information. Here again is that, having that list. Some people like to put it in a binder. Kyle was a pretty organized guy, so he did have a lot of statements. So we actually went through those and got rid of ones from 20 years ago and just kept like the final year or two. He, had an estate plan, but it was old, so we wanted to update those. We did all that. We didn't have an insurance policy, so we actually reached out to the company and got a replacement. That's not really necessary to have that. I've helped many people settle estates, and as long as you have hopefully the contract number of the life insurance policy and a death certificate, they'll just use that. Healthcare end of life wishes again. Carl did a really good job of getting down in words what he really wanted, and we put a list of his passwords and logins together so his wife could log into his email and all that stuff, and he was okay with that because he wanted to make sure if something came in after he was gone that she'd be able to access that. And again, having that list, I put this on that kind of cheat sheet thing of account numbers and contact numbers, but having a list of professionals, who's the attorney, who's the CFP, which is the certified financial planner if there is one, who's their CPA. If you don't know that, you can usually get that off the tax return if they hired someone to do their taxes. So these are all really important documents to have. You don't have to do all this stuff at once, but it's good to start chipping away at this. And I can provide things for people that want them, that kind of like a little checklist on like, what to do, what to get, and what to do it. And number 8, which I think is really important, is the emotional support. Carl was this type of guy that I don't think that I would have his attitude. He was amazing through all of it. But he was a really strong guy, was very organized, accepted things. So, but he had a very close family. But this is important to have, family or close friends to help you figure these things out. If you don't have that, especially, counseling, a support group. We have many of our clients that we've referred to therapists that work in this area, which is really helpful to have someone to talk about because it's, it can be really hard. And planning ahead is really, I think it's an act of love because this is one of the best gifts that Carl gave his family. They could focus on grieving and supporting each other and didn't have to focus on all this minutia of like, did he have an account over here? And I thought he had a life insurance policy. And do you know about that? Or where can we find that? And rummaging through, I've heard more stories where people are rummaging through stuff. They find stuff later on, it could be even years after someone passes away. It's like, oh, here's a contract for this, or here's some savings bonds. you really want to get all this stuff organized as soon as you can, whether you're, super healthy or whether you've just been diagnosed. It's an extra step, believe me, and it's not easy, but that's why you have to chip away. And using a checklist where you say, you know what, this week I'm going to focus on this, and next week if I feel up to it, I'm going to check off these two things, and you just got to get it done. And we are here to help. So number 9, I thought I was done. You're not alone. So we're here to walk you this road with you. You don't have to make all these decisions in one day for sure. And we want to focus on the important stuff too. What's the next step? We can help you do it together with your family. We can work together and getting stuff done. Again, don't feel overwhelmed because it can be very overwhelming in addition to everything else that you're going through. And yeah, we're here to help. So I think the last slide has my contact info. So my offer has always been through this program. If a patient has a question, it's usually better to email me at rick@planwithfps.com versus calling, because then I can send you a link to my calendar, which has a way for you to just hop on a 20-30 minute call with me. Because generally I'm either doing this stuff or I'm on the phone or helping clients. So again, you can either call me, email's best, but we are here to help. And if you're not part of the Dana-Farber Pro Bono Financial Coaching Program and you think you could use a little bit of help, even if it's just like, I've got these credit card bills and I don't know which one to pay, or I'm having trouble paying these, that's a perfect reason to reach out to us. If you don't have an estate plan and you're worried about that, that's a good reason to reach out to us. If you have, student loans and you're having trouble paying them, that's a good reason. So anything that you're struggling with, whether it's debt, whether it's just like, I don't know how much is coming in, I don't know where the money's going, we can help with any of those things. So feel free to reach out to me personally if you're not working with a social worker or a resource specialist. But if you are, they're kind of the first line of defense. They'll gather some data, have you sign a form, they'll get that to me. I'll match you up with, we call them financial coaches, but they're all certified financial planners. They've been trained in this program. We've gotten together at Dana-Farber. They understand the whole thing. And they'll usually reach out to you once you sign up within a week. So you'll get some help pretty quickly. I think that is it. And we're back.
And we're back. Thank you so much, Rick. This was a
Sure.
very helpful presentation. As I mentioned earlier, the session was recorded and it will be posted on our Blum YouTube playlist and our Blum Digital Resource Center.
Sometimes, people have told me that they've seen these, but then 2 months later they say like, yeah, now I think I'm ready to reach out and get some help. So it's not always the same day, but we're not going anywhere. We've got a group of, at least 30, 40 financial coaches that are standing by, ready to help. And we can't help everybody, unfortunately, because some things are just out of our control, but we'll do what we can.
Awesome. So if, to our folks that are on, if you have any questions, you can always reach out to the phone number like Rick provided, as well as the email. And thank you so much, Rick. Have a great rest of your week, everyone.
Thank you. Yeah, you too.
Thanks. Bye.
Bye.